Welcome to Alumni Takeover Week. My name is Dr. Daniel Benonis, and I'm an adjunct professor in the Music Theater and Film Department at SJU, teaching an Intro to Music Therapy course this semester. Throughout this week, St. Joe's has invited alumni to join in conversations about their career and give insight into different career paths and industries and get advice on how to enter and thrive in these fields. So today, it's my pleasure to introduce our guest, Olivia Centoza, a dedicated music therapist at Mount Sinai Kravis Children's Hospital in New York. Her journey began at St. Joe's University, where she discovered her passion for music therapy as a first-year student. After earning her bachelor's degree in music with minors in psychology and music industry studies, she pursued a master's in music therapy at NYU. And today, Olivia provides compassionate care to pediatric patients in the emergency department using music to heal and comfort. And so, Olivia, today I have a list of questions I'll be asking you, and then we'll have a Q&A with our students today as well. So let's get started.
Amazing.
So I'm going to ask you a series of career-focused questions. And if you need any clarifications, let me know. And so the first question that I have for you today, Olivia, is could you describe within your current role your core responsibilities and what a typical day or a day in the life of a music therapist that is in your position would look like?
Yeah, so I work at a children's hospital on the Upper East Side in Manhattan. So I work specifically in the emergency department. So it's a part of the children's hospital, but then separate, a part of Mount Sinai. We have a pediatric ER as well as like an adult ER. So I'm just in the pediatric ER. And I'm a part of a big team. So it's a child life and creative arts therapy team. So there's music therapists, art therapists, child life specialists that are a part of our team. And we're all located within different areas of the children's hospital. So I'm in the ER, but we also have child life specialists, music therapists, art therapists that are in the NICU, the PICU, the like hematology oncology units, more like inpatient units, outpatient units. So yeah, I typically work a 40-hour work week, and I do 4 10-hour shifts. So I work Wednesday through Saturday in the ER. Yeah, typical day. It's always different, which is exciting. I interned at this hospital when I was getting my master's, and I was more on the inpatient side, working in the ICUs and the oncology units. So that looked a little bit different than what I do now. But yeah, I would say every day is different. I walk in and it really is based upon which, like what patients are in the unit. Also, like what doctors are on the unit. Some days could be busier than others, depending on who's working. But yeah, I mostly just kind of space out my day by looking at the like the medical track board that I have like a login to. I can see all the patients that are in the ER currently, and then that are in like the waiting room waiting to come in. And typically every patient that comes in gets some type of procedure done. So whether that's like minimal procedure, getting their vital signs taken, or it could be something more severe like fixing a broken bone, stitches, IVs, blood draws. So I kind of base my day based on the like procedures that are going to take place, assess who I think needs me most, where my top priority is, check in with the medical team, and then check in with the patient and the families themselves, because it is a pediatric ER. It's also kind of important to work with the parents or caregivers that are with the patients. So yeah, I'll just kind of do like an introduction, start building the rapport with the family and the patient, come up with a coping plan for them for the procedure, and then be in the room with them when the procedure is taking place to provide support. And then even stay after and do some like post-procedural support just to kind of ensure that they're regulated, and talk about maybe things that went well. And yeah, so every day is different, but that's like a typical day. And then of course like meetings and looking at like Amazon lists to do like monthly supply orders. We also do like little arts and crafts coping kits for the month, so kind of just like creating those little toiletry coping kits. Sometimes patients have to stay overnight in the ER and wait for a bed upstairs, so just kind of creating those things that have like toothbrush, shampoo, toothpaste, all those good stuff that they'll need. So yeah, it's a typical work week.
Okay. I have an offshoot question of that. While maintaining client confidentiality, can you maybe walk us through what types of music you might be using or how you might be using music to approach specific clinical goals?
Yeah, for sure. So I always like to assess if music is a source of coping or even just a source of play and expression that the patient uses outside of the hospital, because I think that transfers nicely when it is something that they use like on a daily basis, and then we could transfer it into using it during a procedure. So yeah, just kind of assess like, do you like music? Do you play any instruments? Things like that. And then depending on their age, like asking more specific questions. And then, yeah, I'll base my intervention off of what they say. If they are in a lot of pain, sometimes I'll focus it more on like a music assisted relaxation kind of intervention, maybe like some deep breathing, some guided imagery. Sometimes they don't want to participate, but they just want to listen. So we'll do more of like a music listening activity. Yeah, it's totally up to the patient themselves. And sometimes they're like, oh, I don't know, like I want music, but I have no idea what like you could even provide. So then sometimes I'll kind of do just some improv based things and test things out, bring like multiple instruments in, and see what is working for them and what's kind of keeping them regulated, and kind of go from there. Yeah.
Great. Okay. Music therapy is definitely a very niche field, a very beautiful field. But for you in particular, how did you decide to pursue this career?
Yeah, that's a good question. I actually went to St. Joe's as a decided actuarial science major. Fun fact. I was really good at math, so I was like, let's do that for a living, make good money and crunch numbers. And then I wanted to take some music classes just because I've always loved music and singing. And I think I took my first semester, I think Music Theory 1 with Dr. Sorkin. When I was going through orientation, I was like, I just want to take like one music class, and the orientation leaders helped me like choose one. They're like, let's do Music Theory 1. I'm like, okay. So we did that with the intention of me then meeting Dr. Sorkin and then hopefully declaring a music minor. And I had spoken to her, and I think it was like a few months in, and I was just like, I don't want to be an actuarial science major. I cannot do this forever. So I started talking to her, and she actually introduced me to the field of music therapy. She's like, actually, have you heard of, music therapy before? And I was like, no, what is that? Sounds really cool though. And she kind of had sent me some articles, and then I just started doing some like digging and research. And I found actually like this YouTube video that, of course, it was deemed music therapy, but now knowing it is not music therapy, but it was a little girl singing to her brother who had Down syndrome, and she actually like taught him his first words through music, which was really cool. So I just started like going down the rabbit hole, and then Dr. Sorkin introduced me to some Philadelphia music therapists when I was, I think this was more towards like my junior year, and so I like shadowed them, and yeah, I just fell in love with the field. I fell in love with using music as a way to help others. I think it's so special. And I also love now being a part of the medical field. I think it's like super like niche within the music therapy fields to be within that setting and population. And yeah, that's kind of like where it all started.
Great. That's awesome. Thanks for sharing
Mhm.
that. As you had mentioned, in working in a medical environment, your day to day can be completely different depending on where the client is and depending on what or, where the patient or the client, what their needs are, and how to approach those specifically and uniquely through music therapy. What do you feel like is something or some things that surprise you the most about your current job?
Yeah, I think going into it, I was like, okay, it's going to be like heavily reliant like on music. I'm going to be doing music every day, and I do music every day. But I think there's also some unique moments where patients might not respond to music in a way that's supportive to them, and so I think stepping out of like that role, um, and I think it's hard because then it's like, oh well, I'm not being a music therapist if I'm not using music, but I think just meeting them where they're at is super important. Like I've had sessions where I'm, engaging in like arts and crafts with the patient to build rapport with them. And then maybe we could eventually like turn that into something musical, or we just stick with arts and crafts while the procedure is happening if that's what's best suiting them. It's still therapeutic in nature, and I think that was like hard for me to kind of like change my mindset and be like, oh, but I'm not being a music therapist today. Still being a music therapist, but maybe just using a different source of art to help them in that moment. Um, and I think another thing that is surprising is how much like family care it is when you're working in a pediatric setting. Sometimes the parents and the caregivers are more upset and more agitated than the patient themselves. So it is a lot of work with parents and providing emotional support for them through these hard times. I mean, it's, of course, I don't have children, but I could imagine how, and I see it on a daily basis with the parents I work with, of how stressful it is to watch your kid go through a procedure or see your kid in pain. So providing support to them as well. And we have social workers in the ER as well. So even doing like a collaborative, session and helping to emotionally support the families is a big thing that I was like, oh yeah, I'll be doing that. But I think I do it a lot more than I thought I would have prior to getting the job. And then also we get a lot of patients that have some psychiatric diagnoses, which I didn't realize how often that we would get those in an ER with like kids coming in with either like suicidal ideation, homicidal ideation, OCD, anxiety, all different kinds of mental health disorders and coming into the ER. So I do a lot of like sit down music therapy sessions working through their challenges with them using music, which is kind of special. I didn't think I would see that a lot in a pediatric ER, but I actually see it more often than I thought I did.
Okay, great. Thanks for sharing that. In terms of so I hear you talking about your current job. Can you talk a little bit about what your clinical training experiences were like, your first internship leading into your first job, maybe some surprises that you had there, but just overall in general, what your clinical development um, looked like? How did you get your first internship? What was it like? What was your experience?
Yeah, so I went to NYU for my master's, and they do like a pre-internship your first year. So it's not like as many hours as a regular internship is, but still working with under like a music therapist. It's a lot more maybe like shadowing the music therapist, and still going to school at NYU while doing that. So I was at like a private practice for my first year. I went to NYU for 2 years. So the first year I was at a private practice. And the music therapist there worked with a lot of different clients, like different ages. And yeah, that was super exciting. It was more of like not, I wasn't like leading the sessions, which was good because I feel like I was nervous as a first year music therapy student. So just watching was important. And then like partaking in the sessions, but not leading them. He did like a lot of like music and like songwriting and like changing like lyrics and lyric discussion, a lot of rhythmic based things as well, because he was a drummer as his lead. That was his like main instrument, which is really cool because I'm awful at the drums. So that was really cool to experience. So that was my first year, which is like the pre-internship, and then like your full-blown internship. We did our second year, and they kind of helped like set that up for you. You have to do an interview and audition, but every music therapy student has to do an internship. So they kind of list out the like, here are the pediatric settings, here are the adult settings, here are medical, here are like nursing homes, and then we kind of like go from there and like see which one interests us. And that's kind of what the pre-internship is for. So you do like some pre-internships and see like, oh, I liked working with that therapist, or like, oh, I didn't like that setting. So you kind of get like your feet wet. And then the second year, you're supposed to kind of pick the setting and population where you think that maybe that would like be most beneficial towards your like training and where you want to go once you graduate. So I wanted to do pediatric medical setting. So yeah, Kravis Children's Hospital, where I work now, was where I interned, lucky enough. And they try and like have as many sites as many students. So this way, and some sites take like more than one student. Kravis only took one student. So they try not to make like, your classmates go up against each other. So the NYU professors are good at like kind of being like, oh, okay, well, Olivia wants this setting, and like maybe have like only one or two people audition for that site itself. And yeah, so I did the interview and audition, and then they chose me, which was amazing. And then we started working together. Yeah, like my second year at NYU, and it was from September, like the beginning of the school year, September, all the way through till May. I think it was about like 25 hours a week, I want to say, while maybe like 25 to 30, while going to grad school at night, which was very busy. But yeah, so it was like an audition process, and we did it over Zoom because it was, I think it was like 2021, I want to say, when it was the interview. So still like COVID-ish times. So we did it over Zoom. And yeah, they just asked me to like play some things, and it was like a regular like talk based interview. And then yeah, I started and I did it all the way from September through May, and then I graduated that May. But I was mostly in like the inpatient team because I was under a supervisor that was working mostly on the hematology oncology unit and on the pediatric ICU. So I followed her, and it's much more like individualized, your second year internship. So I kind of shadowed, her name was Jasmine Edwards. I shadowed her for like a week or two, just kind of see the interventions she does and how she works with the population. And then after that, they kind of just like set you free. And you're just like your own music therapist, just you and the client. And you start building your client list. I took like some of her clients, started working with them. And then you build as you know the year goes, and you're just like one on one. Sometimes she would come and then like shadow me, and then we would have like weekly supervision to kind of like chat about the sessions or if I had any questions. But it's much more like independent on your second year internship. You're the sole music therapist in the session. It's just you and the patient. So that was like a big difference
Mhm.
from first year to second year.
Absolutely.
Yeah.
Yeah, thanks for sharing that. Okay. I'm going to shift gears a little bit here. I know that in music therapy, we are often we are not, we are often, we are always meeting the client where they are and using ISO principle to connect with where clients are, regardless of who they are. But what are some ways that you would identify that music therapy as a field, or your organization in particular at Mount Sinai, is demonstrated to the commitment of DEI, diversity, equity, and inclusion?
Yeah, that was something I even asked my like when I went for the interview for the job for the ER. I had asked the people that were interviewing me that same question because that was super important to me. And we touched on it while I was like an intern there, but I really wanted to see how they grew since then. It was like a year later, so I was curious about their DEI opportunities that they had. And they have now that I'm a worker there, I see all that they have. Mount Sinai is really good at advocating, I think, for um, patients of varying, you know, backgrounds and challenges and genders, ethnicities. We do have a health equity journal club, which is really nice that we meet once a month, and they always pair someone from the child life and creative arts therapy team, which is my team, and then a pediatric resident, a medical resident, and they'll like pick out an article together that talks about um, something challenging that a family will like go through in a medical setting, or someone with like a certain diagnoses that maybe they're looked past, of like their pain levels are like kind of shoved away because of their race, anything like of those like nature. We'll kind of look at those articles, we'll pick one out together and present on the article, and we'll send it to everyone beforehand so everyone could read the article, and then kind of come together once a month to discuss it, and then discuss maybe if we've experienced like similar situations, and then how we kind of combat those challenges that came up, and how we could work through them together as like being active members of the medical team. So that's something that's really important that I love to go to once a month. And then they also have chats for change that are like very similar. I think those are more based upon maybe not like research articles, but just like things that we've witnessed in the hospital that were challenging for us, and how we could take like further steps to then make the changes to be more inclusive. Um, yeah, and then we also have an individual supervision biweekly with like our supervisor and our team, and then group supervision, which is biweekly. So we have people that's a part of our team that are either like art therapist, music therapist, child life specialist, and the supervisor. And we have like biweekly group supervision where we bring some challenges in for the week, or some things maybe that like went wrong, we needed advice on, or um, anything of that nature, and then kind of like share it with the group, and then kind of work through ways of how we could have done better, how we could address the situation moving forward. So I find always supervision to be very helpful to have, and you can kind of get like different ideas from other people that are a part of your cohort, and see maybe if they've experienced the same thing as you, and how they worked through it, which is really helpful.
Absolutely. Okay. Thanks for sharing that. And in line with this supervision and connecting with other teams, can you talk a little bit about specifically, as we've been saying, music therapy is a very niche field. What does networking and community look like for you? And maybe what are some tips that you have around networking and community for those that are interested in pursuing music therapy?
Yeah, I would say, I mean, I'm biased because I'm a music therapist, but I feel like we are a field that is very supportive. Um, I've like reached out to even people that I like shadowed back when I was like an undergrad, and they were like, "Oh my God, so nice to hear from you again." Like always so helpful. And I had reached out to those people back when I was like applying for jobs and seeing like, "Oh, do you know anyone, any of your friends or something that are at certain sites that have like positions open?" So we're a very like close knit community. Um, and NYU, I think one of the reasons I went there is because they were so great at connecting people. And actually, the supervisors at Kravis went to NYU as well, so it was super helpful to kind of have that like connection. And I know that they went through like the same training that I did, and they all stay super close. I could reach out to any one of them for like a letter of recommendation, and I know that they would be happy to do it. But the NY community itself too. They keep in contact with each other for like job openings. So that's kind of how I got this job in the ER. One of the professors would send out like a to past students and like current students of like job positions whenever like a supervisor or someone would like email them, a former student, and like, hey, my job is like has a new opening for someone, blah blah blah. And so that's how I found out about the position in the ER being open. Is the one of the NYU professors, or my supervisor taught like the NYU professor, and was like, "Hey, we have this opening. Would you mind, sending it along to that email chain of like past and current students?" And then they had sent it out to us, and that's how I found out about it. So that is one of the big things that I loved about NYU, is like how close we all are and wanting just everyone to prosper and get into their field. And then I also shadowed like those music therapists in Philly. So even though like they did not go to NYU, they're just like always so helpful. And I think everyone in the field is also constantly a student. I know different techniques, or just learn how people use like certain interventions at certain populations. I'm a part of like a Facebook group that one of my supervisors told me about. I think it's called like Music Therapists Unite or something. But like people are always like posting questions in there. I'm like, oh, like I need like advice on like a 12-year-old patient that blah blah blah, and then like people 50 comments like a day of like, oh, maybe try using this intervention. I've done this. So um, I think just even just stepping into the field, you're already doing the networking itself, because everyone just wants to help each other, and we want to just keep having the field grow.
Absolutely. Yeah, and I agree that like, being a music therapist in Philadelphia, I definitely see that down here for sure too. Everybody wants to help everybody. Um, okay, I'm going to combine some of these questions just for sake of time because I want to make sure we have time for the Q&A.
Yeah.
So what is something that you wish somebody told you as a music therapy student, and what are maybe 2 or 3 experiences that you feel like students should engage in as they're developing or moving towards developing as a music therapist?
Yeah, I feel like people didn't tell me this enough at school, but like it's okay to not be on everybody else's timeline. I think when you're like a junior, senior, you start to be like, oh, this one applied for grad school, or this one already has a job lined up, and blah blah blah. And I think it's like comparing yourself could be um, very detrimental when you're going through all the post graduation things, or sometimes like you're not even like a decided major at that point, and people are like, I already got like a job lined up. You're like, oh my god. So I think trying to just like stay in your space, and do things on your own time is super important, because not everybody's the same, and that's okay. Take your time with trying to figure things out, and the opportunities will come to you, as you open up. And 2 to 3 experiences, I think working on your craft is super important. So if you can partake in like just practicing like your instrument either on your own, or like taking the piano, guitar, voice lesson classes that St. Joe's offers, I think like keeping up those technical skills are really important. And then I also partook in a cappella while I was there, which was super fun. So I feel like using music like not just as like, oh, I have to like practice now because I have to play this like Beethoven piece because the recital's in 2 months. Like, yeah, that's good, but also do music to remember like why you did it in the first place. Like, why was it? Why is this fun for you? And like get back to doing that, not just because you're a student. So partaking in like the acapella groups, or like songwriting on your own, or like coming together with a few people, going to concerts. I think that's like always important to like use music for yourself, and not just because you want, you're a student. And I would also say I took a lot of like psych classes too, which was fun. I was a psych minor. So I think that was always helpful going into the music field, because NYU does like a psychotherapy program. So it was important to have those like psych classes as well under my belt with the music classes. And then I think like improvisation is really important too. That's something I didn't know would be um, as important before I got into the field. I think I was just like a type A student, like wanted to get 100 on everything and would like practice all my classical pieces for the recitals, um, and try to be perfect, which is, we're working through that. But I think improvisation is really important too, because I utilize that like I would say 75% of the time working in an ER. Like we're not playing classical pieces a lot of the time. We're not trying to get every note right or like sing on pitch all the time. Like it's okay. So I think partaking in just like sitting down at your piano or like whatever your main instrument is, singing and just improvising and playing how you feel in the moment, um, is really important, because anything can happen when you're working with a patient, and especially when you're working with kids. I feel like they're very all over the place and usually don't like stick to a specific plan when you're with them, kind of are riding the wave with them. So it's important to kind of be think on your toes and be creative and engage in like that improvisation with them and kind of follow them through their journey when you're doing the session with them.
Absolutely. And you touched on two of the other questions too that I'm going to just combine. What other courses did you take at St. Joe's that you feel like prepared you either directly or indirectly to be a music therapist? And how did overall the Jesuit education of St. Joe's impact your work and career decisions that you made?
Yeah, I think the music classes and the psych classes were super helpful. I also took some really cool sociology classes that I thought, I think Dr. Rachel Bergen was her name. I don't know if she's still there, but she was just so fun. And I think the sociology classes were also important because it gives you they're of course not required, but I just took them for fun. And I feel like it gave me just like a different insight into like how people, different people live in like different parts of the world, or challenges that people go through that are not the same gender or race as me, or and the same socioeconomic class as me. And I think that's important because I do work in a hospital that's on the Upper East Side, but it also borders Harlem. So we do get a varying amount of patients that are of different backgrounds. So being sensitive to, something that they may go through that I'm not used to. So is important when you're being their therapist. And I think those classes were eye opening as well. So I liked my sociology classes. And yeah, I think, the Jesuit education is super important because they're dedicated to service and their faith. And I feel like music therapy is a great field that combines all those things of helping others and, trying to heal and serving others. And I think one thing I didn't know that I would impact me so much is we do get like some bereavements and deaths in the ER, not as frequent. I'm gonna knock on wood, but we do get some patients that unfortunately do pass away, that are coming in, not breathing, their heart isn't beating. The medical team has to, do some codes, and sometimes the outcome isn't always what we want it to be. So then providing, those bereavement services to families and being the one to like go in the room and emotionally support this family that just went through such a traumatic experience is really hard. So I think it's important to have, your faith, whatever it may be, to rely on, because you could start to like kind of question like, oh, why is this happening? But, staying in the moment and supporting them, I would say it's pretty easy when it's happening. It's kind of the aftermath of when you go home, and now you're by yourself, on your ride home, or, thinking about what just happened and what you just saw. So it's important to have your faith, I think, to lean back on. And I would say therapy is also super important. NYU is a big advocate for having your own therapist. The field is very reliant on being empathetic and supporting and healing and helping others. So I think it's important, how can you do that if you're not aware of your own challenges and biases and how to work through them yourself. So I think it's always important to have, your own therapist when you're going through either like grad school, then continuing in the field, because it can be a bit challenging. Not all the time. We have those sad experiences, but I don't want to scare anyone, but they do happen. So yeah, I think all those things are really important to kind of just keep you working towards your best self while you're trying to help others. It could be very draining at times. So you want to make sure, you're taking the time and space to provide for yourself too, and help yourself heal and take care of yourself, because that is very important as a therapist.
Absolutely. Self-care is the name of the game, right? Especially
Yes,
when
yes,
working in
you'll
difficult
hear it all the
environments.
time. Yeah, every school, every teacher, self-care. Did you take care of yourself? Did you take a break today? Yeah.
I just have one more question. I want to make sure we have time for the Q&A. And just a couple sentences, what is any other advice that you might have for students either looking to go into the job market of becoming a music therapist or seeking internships or clinical experiences? Any advice that you have
Yeah,
that
I
you
think
hadn't
just
mentioned already?
just kind of be yourself. Try not to stress over things. I know easier said than done. But everything will work out as it's supposed to. And these are all like cliches, but they're so true when you're going through this field. There was like a lot of jobs that, like, when I got out of grad school, then finished my thesis and sat for the board exam, and then I was like searching for jobs from like September 2022 is when I like sat for the boards and passed, and my thesis was done. I was like, all right, let me start job searching, and I knew I wanted pediatric medical as like my setting and my population, and everything on like Indeed or everything that I was like reaching out to people, they were like, oh, it's either like medical and like adults were the population, or it was like pediatrics but like in schools. And I was like, okay, well, I want like a combination of both. So that could be like really frustrating. And I applied for another job, I think that was up in like Yonkers, that I finally found one that was like pediatric medical. And they're between like me and someone else, and they're like, oh, we took someone, we took the other person, they had a little bit more experience. So that was frustrating too, because I was like, well, how can I get the experience if no one's going to give me that first time to get the experience? And I think I like was a little bit hard on myself. I was a little bit let down, but I think just try not to, harp on that stuff. And I think like that was maybe like end of October, early November. And then I think like a few weeks later, I got the email from my NYU professor that the other, like a job had opened up in the ER at Kravis Children's Hospital. So if I had took the other job, if they gave it to me, then I wouldn't have had the opportunity to go back to Kravis. So yeah, I think just kind of take things as they are. It's a very niche field, and I think it's hard to maybe get into the population and setting that you want to right away, and that's okay too. I think I would have accepted that, and if I didn't, and went in a different setting, and then who knows, maybe I would have liked that setting even better. So there's always room for like movement, and then the more you network and the more jobs you have, you'll never know then what could open up. Who knows who in a certain area. So yeah, I think just give yourself grace, and just be open to new experiences as best as you can.
Awesome. Awesome. Thanks so much, Olivia.
Mhm.
This was really helpful at illustrating. I hear a lot and understand a lot of what you're saying. We're gonna be moving to the Q&A portion of the session. So students, I'm encouraging you to ask questions of Olivia. Keep in mind that I can see who's asking questions and that you have a participation grade coming up that will impact your grade. So ask some questions. No, I'm not using that as a threat. I am encouraging you guys to ask some questions though, since we've been spending all semester talking about building up to clinical practice, and so I'm curious as to what some questions are. And so it looks like we have two so far. I don't know if you can see these or not, Olivia, but I'll read them to you.
Cool.
So the first question is music therapy commonly used for post-coma patients to revive memory loss? Do you have any experiences with this? And then in parentheses, it says, I heard of a woman gaining her memory back after hearing childhood and familiar songs that she would commonly hear.
Yeah, that's a good question. I've seen like videos of that too, and I was like going through training, and I was like, that was like one of the reasons too. I was like, this is so cool that music could access different parts of your brain, like for like speech loss and memory loss. So fascinating, like literally so cool. But yeah, I haven't worked with comatose patients specifically. I did work with when I was an intern. I was on the ICU, and I worked with sweetie 6-year-old girl that she wound up having a brain tumor. She came in like really dizzy and kind of off balance. She was throwing up, not eating the same. And then parents, brought her in, and she wound up having a brain tumor that was sitting on like a certain part of her brain that was also affecting her vision. And so they took it out. So I met her. I don't think I met her post or pre-surgery. I met her post-surgery, and they had taken out her brain tumor. And then I think the area that they took it out of, then it also, they say that it could affect like speech and memory. and your vision as well, because they did take out the tumor. Then they also, it was laying on a certain part of the brain that they maybe had to like cut out too, and it kind of has to like now shape itself back together. So I had met this 6-year-old after her surgery, and parents were really concerned because she wasn't acting herself, but the doctors, said that's normal after a traumatic surgery like that. And so I met with her because the medical team wanted to do like speech therapy, music therapy, and physical therapy with her after the surgery. And they thought music therapy could help her use her voice again and like start regaining some speech. So I did a lot of Frozen with her, which was really cool. She loved Frozen. So we kind of combined and we did like co-treatments, me and speech therapy. And it was so fascinating. And we did a lot of singing, like Let It Go. That was her favorite song. So a lot of I'm not sure what the interventions like the speech therapist specifically used, but they were trying to get her just to say some words and use like her big girl voice. That was their goal. And they wanted me to come in and help facilitate that intervention by using music, because they thought that would be more motivational, more beneficial than asking her to like repeat the same sentence over and over again. I think that's like really frustrating for a 6-year-old. And then also the fact that music can access a different part of the brain. So we did a lot of like slowed down singing of Let It Go, a lot of like fill in the blank, like slow strumming and like letting her say the words. And yeah, it worked. And I like wound up seeing her, I think, like towards the end of my internship months later. And she was like went to an outpatient facility when she was like physically able to do so. And she did like a lot of rehab there, music therapy. I think she might have been at Blythedale. She's like an inpatient, like children's hospital. And they continued the same stuff that we were doing at Sinai. And then I wound up seeing her again like 6-7 months later. And she was like getting slowly back to like her like typical self of like what her parents were used to, like her typical 6-year-old. And she was like walking, talking, singing, dancing, being like her sassy 6-year-old that I knew her to be, and talking like a lot more than she was when I saw her like the 7 months prior. So yeah, she wasn't in a coma per se, but it was like that's like the closest kind of situation that I've experienced of like using music to help with speech after a brain surgery.
Absolutely. And I know somebody had the part of the question was about coma patients, and just as a side, since I'm also here, there's a training called Matadoc, music assessment, music therapy assessment for disorders of consciousness. That's something that can help connect people to that are coming out of coma, connect to music, and then music can connect with some of those memories. The next question that I have here, oh, this is a good one. What would you say has been the hardest part of becoming a music therapist?
That is a good question. Hardest part, I think, it's not like becoming a music therapist wasn't hard, but I think that comparison of when you're interviewing and going through the process of like trying to get into the schools, and then once you're in the school, you would think like, oh, okay, like I'm good enough because like I made it into the school, but then you're still constantly like comparing yourself to like the other students that are next to you, and who's a better singer, who's a better guitar player, and who's a better student. Like so I feel like that was always like, that's more of like a personal challenge, I guess, but that was always challenging for me too, is like that constant comparison. And then even like as a music therapist now, I have a job and like I'm always like, oh, like my supervisor's so good at that. Like when I'm like shadowing a session, I'm like, oh, like why can't I do that? Or yeah, I think that's always like a challenge when you're in a field that has like is involved in like the arts. But yeah, becoming a music therapist specifically, I'm like such a nerd, so the student part wasn't hard. I would say maybe also like the finding the love for the music again, like within yourself. It could be like hard. You have barely any time, I would say, when you're a grad student, between the homework and the school, and then the internship, and then the homework and projects for your internship. And so I think like finding that time to those 30 minutes or an hour a week to like not do music for practice based or like student based or like anything clinical based, and like doing music again for why you love it. Songwriting for me personally, performing. I think that was like a big challenge too, because it feels like you kind of have to step away from that part when you're a student and you just want to like focus on being the best music therapist you can be and the best student and doing all the research and the homework, and working with the patients. But I think what I didn't know back then is like putting the work into yourself is also going to help you become a better music therapist, and practicing and doing music because you love to do it is really important. So I hope that answers your question.
Absolutely. Yeah, good answer. Next question is we have what methods of music therapy do you use the most? I know you mentioned improvisation. Are there methods that you prefer using over the others?
Yes, I hate improvisation, but I do it all the time. I feel like I'm so bad at it, but we do it all the time, which is good practice. But yeah, it's a lot of like music improv in the sense of kind of like switching songs, like, and like toddlers are like not gonna have the best sense of like focus. So I feel like it's more improvisation in that sense, or like when you're on one intervention and then like it doesn't seem to be working, like quickly trying to be like, okay, like where can I go? Where can I take this next to see if that'll maybe help the patient when they're in pain or they're crying or they're anxious. So like improv in that sense is kind of um, super important in an ER setting, I think. Um, I definitely love a good music assisted relaxation intervention. I'm a vocalist, so anytime that I could just sing some lullabies, do some like entrainment, watch, their cries, and some tonal vocal holding, and kind of match a child. I love working with the tiny, tiny friends. So yeah, I think those are kind of like my favorite of just more like yeah, like deep breathing and using my voice as like the primary instrument, I would say is my favorite. Um, what other interventions do I do? I do a lot of like anxiety reduction interventions as well. So I would say like I've done a lot of like progressive muscle relaxation of like having the patient kind of close their eyes, and like you kind of like tighten every part of your body one at a time, and I'll like guide them through like a script as I'm like playing guitar and improvising and doing like these kind of just like melodic slow um, chordal movements with the guitar, and then yeah, doing like a deep breathing and like a progressive muscle relaxation of like you tighten one area and then like feel it release, and then you go like all the way up to like certain, up to your head. And then also like a lot of guided imagery and stuff I'll do too. As like, using music, I'll do like either piano or guitar. Guitar is the easiest in the ER because it's like you have to fit into little tiny areas, so I do use my guitar the most, as well as my voice. And doing like a lot of guided imagery of like having scripts to kind of do like, like five senses of like picturing like, your happy place or somewhere that's not in the ER. And then I'll kind of go through with them of like picturing what that place smells like, what that place looks like, sounds like, as I'm like playing guitar as well. Um, and then a lot of like, I would say like music, more like entertainment based stuff where like kids are so honest and they're so fun and carefree, which is why I love working with them. So they'll be like, yeah, I want to sing a song. Like they have not a shy bone in their body. So a lot of like them telling me like preferred songs that they want to sing, and then like just jamming out with them and singing with them while the procedure's happening. And then kind of that's where that like music improv takes place, because of course if they're getting like an IV before it's happening, we could be jamming out and having fun, and then all of a sudden the needle comes out, and then we're not having that much fun anymore. So then kind of switching over to like, yeah, like a music assisted relaxation, um, guiding them to like look at me, do some breathing depending on their age. I'll have like other instruments too, like ocean drum with me if they want to like partake in playing another instrument. And then sometimes they're too distressed and they like don't even, the music isn't even helping at all. And sometimes like the sound is like too much for them. So sometimes depending on the patient, I'll like step out and then come back in and do like a post procedural support and like post procedural regulation with them. Um, and then if not, like maybe they just like want to have like a visual aid to look at during the procedure because they don't want to listen to anything and they want to like be distracted in that sense. So then kind of like throwing my guitar behind my back and like putting on Bluey, like if that's their favorite show, singing along to like the Bluey theme song. So yeah, those I would say like are probably the main the main interventions I use down there. If I think of
Great.
more, I'll let you know.
So we have two last questions, and I think this is going to bring us right to the end because we only have
Perfect.
2 minutes left. So maybe the one of these might be a little bit of a shorter answer.
Okay.
It says, I know that individual therapy sessions therapists usually aren't allowed to treat their own family members or friends professionally, but within music therapy, is it acceptable to treat your own family members and friends or not?
Oh, that is a good question. I don't know the exact answer to that. I don't know if Dan can help us out with that. I work in a pediatric ER, and none of my little cousins have come into the ER. I'm from Staten Island, so they've never traveled to the Upper East Side. I would imagine I would like to support them if they came in and they were having a procedure done. Um, I don't see why I wouldn't be able to in that sense, but more of like a sit down, like one-on-one music therapy session. Not sure if that is allowed. I don't know. Dan, have you heard of anything
Yeah,
regarding
it's
that?
ethically we're not supposed to treat people
Yeah.
that we have uh, a relationship that's beyond acquaintance with.
Yeah.
Yeah,
Yeah. I honestly, my supervisor would probably, if I told him like a little cousin's in the ER, he would probably be like, I'll come support and you be their family
right.
member. Like,
Yeah. Yeah, we can support kind of like from a
as
distance,
a family
but
member.
we can't
Yeah.
be, yeah, not as direct care.
Yeah.
The last question for today that's going to bring us to the end is, what domains do you find most challenging when working with patients? For example, do you struggle more with physical or cognitive aspects?
Um, I think I struggle the most probably with patients that come in that are like ACS cases or, like rape victims or anything that's like super traumatic. I think I like internally feel some type of way about it. So I think sometimes it's hard for me to like um, get in that therapist mindset and provide support for them because I'm just so like angry and upset about what they just went through, or like assault victims, anything of that nature. I think it's always pulls at my heartstrings. So I feel like that's the hardest for me to go in because I just want to like hug them and be their friend. So I think pulling back and remembering that I'm the clinician and trying to assess and see how I could best support as their music therapist is always a challenging juxtaposition that I go through.
For sure. For sure. Okay. Well, that brings us to the end. So, everyone, please join me in thanking Olivia for joining us today and providing such great insight into being a music therapist in a pediatric facility providing music therapy. And we're grateful for your time here today.